Did you know that unexplained itching in certain spots could be your body's quiet warning about cancer? Most people brush off a little itch here and there, but for older adults, especially those over 60, itchiness in very specific areas might be more than just dry skin or irritation. It could be your body sending you a signal you can't afford to ignore. In this video, we're going to uncover 5 very specific itchy places on the body that could indicate cancer, sometimes months before any other symptom appears. These are not random itches. They're patterns doctors have seen again and again in patients who were later diagnosed with serious conditions like lymphoma, pancreatic cancer, and even breast or skin cancer. Stay with me through the end because we're not just listing body parts. You'll learn the deeper reason behind each one, why these areas itch, what cancers they're linked to, and how to tell the difference between a passing skin issue and something more serious. You'll walk away knowing what to watch for, what questions to ask your doctor, and what action to take if one of these signs sounds familiar. And most importantly, this is not about panic, it's about paying attention. Because the earlier you notice these quiet signs, the better chance you have of catching something before it becomes harder to treat. Let's begin. Sign 1. Persistent itching on the lower legs. When older adults start to experience a persistent itch on the lower legs, especially the shins and calves, with no rash, no dryness, and no new soap or lotion to blame, it might be easy to write it off as aging skin. But this very specific symptom has quietly shown up in many people diagnosed with blood-related cancers, especially lymphoma. It's not the kind of itch that comes and goes. It lingers. It often gets worse at night, and it doesn't respond to lotion the way dry skin does. The reason this happens has to do with how cancers like Hodgkin's lymphoma affect the immune system. These cancers originate in the lymphatic system, a critical part of the body's defense and drainage network. As the cancer cells multiply, they release inflammatory chemicals into the bloodstream. And one of the most common side effects of these chemicals is a deep, almost burning itch that settles in the lower limbs. Even though the skin might look completely normal on the outside, the nerves underneath are being irritated from within. There's a man named George, 75, who shared his story during a routine cancer awareness event. He said his only symptom for nearly 6 months was an uncontrollable itch on the front of his legs. His doctor initially thought it was eczema, or maybe a reaction to detergent. But when blood tests showed abnormal white cell levels and further scans revealed swollen lymph nodes in his chest, the diagnosis became clear. The itch came first, he said, long before anything else. This kind of story isn't rare. And while not every itchy leg means cancer, the key difference lies in how the skin responds or doesn't. If there's no rash, no new soap, no bug bites, and it's been going on for weeks, it's time to dig deeper, especially if it's paired with other quiet signs like night sweats, fatigue, or unexplained weight loss. For older adults, this kind of awareness becomes especially important. As we age, our bodies become less obvious in how they send distress signals. The pain might not come right away. The lumps may be too deep to feel, but the nerves still react. An itch, particularly deep, restless, unrelenting itch, is often how that reaction first shows up. If you or someone you care about has been scratching their legs every night, applying creams with no relief, and wondering why nothing's working, don't ignore it. Talk to a doctor, ask about blood work, mention the pattern, because sometimes the body whispers long before it shouts, and listening can make all the difference. Sign 2. Itching between the shoulder blades or upper back. There's a specific kind of itch that shows up deep in the upper back, right between the shoulder blades, that's often ignored or blamed on posture, dry air, or even an old shirt tag. But for many older adults, persistent itching in this exact area, especially when it feels like it's coming from under the skin, has been linked to pancreatic cancer. And the strange thing is, it often appears months before any noticeable pain or digestive symptoms do. The connection might seem odd at first. How could an internal organ like the pancreas cause itchiness way up on the back? But here's how it works. When pancreatic tumors begin to grow, they can obstruct the bile ducts, those small tubes that help drain bile from the liver into the intestines. When this drainage slows or stops, bile salts start to accumulate in the bloodstream. And one of the first things those excess bile salts do is irritate nerve endings. Often in areas like the back, where the body stores a dense network of sensory nerves. I remember a woman named Linda, 70, who told me she had what she called a phantom itch on her upper back. She'd wake up scratching it every night. Nothing helped. Lotions, back scratchers, even changing her mattress. She said it felt like it was coming from the inside. When she went in for blood work for unrelated fatigue, her liver enzymes came back elevated. That led to imaging scans, and eventually they found a small tumor in her pancreas pressing on the bile duct. The scary part, that itch was her only real symptom. No pain, no yellowing skin, just a deep nagging sensation she couldn't shake. And the only reason she caught it early was because she spoke up, even when it felt like a small complaint. This is why that specific area matters. General back itchiness can come from dryness, pressure, or friction. But if the itch is focused, unrelenting, and doesn't improve with skin treatments, especially if you also notice darker urine, pale stools, or fatigue, it may be a deeper sign of something happening internally. The back becomes the messenger, even when the problem is in the gut. For older adults, these kinds of subtle symptoms are easy to dismiss. We don't always want to sound dramatic, but your body is wiser than you think. And when it sends you the same signal again and again, it's worth listening, even if it's just an itch. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Sign 3. Itchy scalp without visible flakes or dandruff. An itchy scalp might not sound like a big deal. In fact, for many older adults, it's easy to chalk up to dry air, aging, skin, or a shampoo that doesn't quite agree. But when the itching becomes persistent, especially when there's no dandruff, redness, or flaking, it can sometimes be an early sign of something deeper happening beneath the surface, including blood-related cancers like leukemia or skin cancers affecting the scalp. What makes this itch different is that it tends to feel more like a tingling, crawling, or burning sensation than just dryness. It may move around from one spot to another, and it often doesn't respond to typical treatments like anti-dandruff shampoos or moisturizing scalp oils. For people over 60, these kinds of sensations can indicate nerve irritation triggered by abnormal immune activity, something that occurs when leukemia cells begin to multiply in the blood and affect how the body regulates inflammation. There was a man named Henry, 73, who mentioned that his scalp had started itching every afternoon. He tried changing hair products, then thought maybe his hat was the issue. But even after switching shampoos and going hat-free, the itch remained. When he eventually got a full blood panel done for unrelated fatigue, doctors found abnormally high white blood cell counts. A bone marrow biopsy confirmed early-stage chronic lymphocytic leukemia. His scalp had been the first and only part of his body, alerting him. What makes this especially important is that many older adults already experience some level of dryness or skin sensitivity. So when something like an itchy scalp starts to feel just normal, it gets ignored. But what sets cancer-related itch apart is how resistant it is. No cream helps, no product soothes it. It lingers, nags, and often feels disconnected from any surface problem. And while leukemia isn't the only concern, skin cancers that develop on the scalp, especially in areas with thinning, hair can begin as nothing more than a small itchy patch. Sometimes it looks like dry skin or a small bump. But if it keeps itching, especially in the same place, and doesn't go away, it should be looked at under proper light by a dermatologist. Because the scalp isn't always easy to examine on your own, it's helpful to ask a spouse, caregiver, or hairdresser to check the area regularly. If you feel an itch that hasn't budged in weeks, and it's not responding to anything you try, that's your sign to dig a little deeper. Especially if you've also been feeling more tired than usual, more bruised, or just off in a way you can't explain. It might feel like a small thing, but sometimes it's the small, stubborn things that tell the biggest story. Sign 4. Localized itching on the chest or breast area. When older adults, especially women, but also men, notice persistent itching on the chest or breast area, particularly around the nipple or just beneath the breast, it can be easy to attribute it to sweat, a snug shirt, or even age-related skin thinning. But this specific area is one of the most overlooked spots where itching may signal something far more serious: inflammatory breast cancer or other underlying tumors near the chest wall. What makes this sign unique is that it often shows up before any lump does. The skin might feel warm, irritated, or tight. Sometimes there's a change in texture, slightly rough, thicker than normal, or with a reddish tint. But just as often, there's nothing to see, only a deep, persistent itch that never seems to go away, no matter what cream or lotion is applied. I recall the story of Ruth, 69, who noticed an odd itching sensation around her right breast. She tried switching bras. She tried different detergents. She even went without a bra for a while, thinking it was friction. But the itching continued, same spot every day. When she finally went in for a checkup, her doctor noted slight skin dimpling and ordered further tests. What they found was a small but aggressive tumor growing close to the skin surface without the typical round lump most people expect. This is one of the reasons inflammatory breast cancer can be so dangerous. It doesn't always follow the rules. It can mimic a skin rash. It can spread quickly, and the earliest symptom is often not pain, but irritation. That's why paying attention to itching that doesn't move around, doesn't ease with moisturizers, and is focused in the same place day after day is so crucial, especially in the breast or chest area. For men, this can be even easier to miss. Male breast cancer is rare, but it does happen and often goes undetected because the signs don't match what most men think to look for. An itchy patch near the nipple, a small area of thickened skin, or a persistent twinge of discomfort under the chest muscle might not sound dramatic, but for someone in their 60s, 70s, or 80s, it deserves a closer look. And there's more. This kind of itch isn't always about cancer growing in the breast itself. It can also be caused by enlarged lymph nodes under the arms or just below the collarbone, signaling lymphoma or another nearby malignancy. So, if the itch is accompanied by swelling, warmth, or even just a vague sense of heaviness in the area, don't wait. Early detection doesn't start with fancy machines. It starts with awareness, with listening, with noticing the quiet patterns that seem out of place. Because your skin can't speak, but it can signal. And this is one of the most important signals not to ignore. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Sign 5. Persistent itching in the anal or genital area. There are few things more uncomfortable and more often ignored than itching in the anal or genital region. It's an awkward subject, especially for older adults, and many people would rather brush it off than bring it up. But when this type of itching becomes chronic, with no obvious cause like hygiene, infection, or irritation, it may be trying to draw your attention to something far more serious. In some cases, persistent itch in this area can be a quiet early symptom of anal, vulvar, or even penile cancer. What makes this kind of itch dangerous is that it often disguises itself as something minor. People assume it's just dry skin, a reaction to toilet paper, a bit of friction from walking, or even a side effect of incontinence pads. And in many cases it is. But when it lingers for weeks or months, when it returns, no matter how much you clean, treat, or moisturize, and when it begins to feel more raw or burning than surface level, it deserves a closer look. There was a man named Eugene, 76, who had been dealing with what he thought was hemorrhoid irritation for almost a year. He used creams, changed his diet, even tried cold compresses, but the itching never fully went away. Eventually, a colorectal specialist ran a scope exam and found a small lesion on the anal canal wall. It turned out to be an early-stage tumor, something that would have continued growing silently had he not followed his gut instinct that something just didn't feel right. The same holds true for women. Vulvar cancer is relatively rare, but becomes more common after age 60. And one of its earliest signs, a recurring itch on or near the outer genital area. There may not be a lump, but the skin might begin to feel rougher, slightly discolored, or thinner than usual. Many older women assume it's hormonal or related to postmenopausal dryness, and sometimes it is. But if the itching is relentless, if it worsens at night, and if it doesn't respond to normal treatments, don't dismiss it. This part of the body is full of nerve endings. It's highly sensitive, and because of that, it often signals internal changes before more visible symptoms emerge. Whether it's a change in skin cells, nerve inflammation, or swelling in nearby lymph nodes, chronic itching in this region, especially when it's only on one side or focused in one small spot, can be a red flag. And yet, most people hesitate to say anything. They fear embarrassment, or they worry they're overreacting. But silence is far more dangerous than curiosity. Speaking up about an itch might just lead to early detection, better outcomes, and peace of mind. The most important takeaway, if the itch doesn't go away, don't assume it's normal. Let a healthcare provider take a look. Because catching something early, even something as serious as cancer, often starts with noticing something small, something subtle, and choosing not to ignore it. Final thoughts. As we close out this video, I want to leave you with one simple truth: your body is always communicating. Sometimes it speaks through pain, other times through fatigue. But often it begins with something so small, so subtle that we overlook it, like a persistent itch that keeps returning to the same place. The 5 areas we talked about today, the lower legs, the upper back, the scalp, the chest, and the genital region, aren't just random spots. They're places where serious internal issues, including certain cancers, often begin to send their first quiet signals. And for older adults, learning to listen to those signals could mean the difference between catching something early and letting it silently grow. You don't need to live in fear. That's not the point of this video. The point is to empower you, to remind you that your instincts matter, and that what seems like a small symptom may be your body asking for help. If any of these signs felt familiar, don't brush them off. Bring them to your doctor. Start a conversation because you deserve answers and you deserve peace of mind. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.